Hi, this is your host. High blood pressure affects nearly 1 out of every 3 adults in the US. And it's often called the silent killer because it can raise your risk for other, potentially life-threatening conditions like heart disease and stroke without any noticeable symptoms. So today we're going to talk about what exactly high blood pressure is, what you can do to keep your blood pressure at healthy levels, and lower your risk for developing hypertension or high blood pressure. First, let's talk about what blood pressure actually is. Blood pressure is the force of blood pushing against the inside walls of arteries, which are the blood vessels that carry oxygen-rich blood away from your heart to the rest of your body. Every time your heart beats, it pumps out a surge of blood to deliver oxygen and nutrients to your organs. That surge of blood creates pressure against the artery walls, and that pressure varies throughout the day depending on whether your heart is at rest or it's beating and pumping. It's completely normal for your blood pressure to fluctuate throughout the day. In fact, it should go up when you exercise or become physically active and then go down when you at rest. Blood pressure readings are expressed as a fraction with 2 numbers. The top number is called the systolic blood pressure, and that's the pressure in the arteries, when your heart beats and pumps out blood. The bottom number is called the diastolic blood pressure, and that's the pressure in the arteries when your heart is at rest between beats. Both numbers together give a complete picture of your blood pressure at a given time. Hypertension or high blood pressure is when your blood pressure stays elevated over time rather than bouncing back and forth within the normal range. And this can make your heart work harder than it should to pump blood throughout your body. Over time, that added strain can damage your blood vessels and other organs, raising your risk for other potentially life-threatening conditions like heart disease and stroke. Now, the scary thing about high blood pressure is that for many people it doesn't cause any noticeable symptoms, even when it's severely elevated. But there are some risk factors that can put you at a higher risk for developing hypertension, including having a family history of high blood pressure, being overweight, eating a diet high in sodium or salt and low in potassium, not getting enough physical activity, and smoking. Fortunately, there are also plenty of things you can do to keep your blood pressure at healthy levels. First, eat a balanced diet with plenty of fruits, vegetables, whole grains, and lean protein sources. Also, be mindful of how much sodium or salt you consume on a daily basis. The American Heart Association recommends no more than 2,300 milligrams per day, but ideally you should aim for less than 1,500 milligrams per day. You can do this by cooking more meals at home using fresh ingredients rather than relying on processed or fast foods. And be sure to read nutrition labels carefully to see how much sodium is in the foods you buy. Next, get regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic activity per week, such as brisk walking, cycling, or swimming, and if you don't smoke, don't start. If you do smoke, then quit as soon as possible. You can also try to maintain a healthy weight, because being overweight or obese can put extra strain on your heart and blood vessels, leading to high blood pressure. Finally, schedule regular checkups with your doctor, especially if you have risk factors for hypertension. At your checkup, your doctor will measure your blood pressure and use that along with other metrics to assess your overall health. They may also run tests to check for other conditions that can contribute to high blood pressure, such as diabetes or kidney disease. If your blood pressure is elevated, your doctor may also recommend additional tests to determine if you have any underlying conditions that could be contributing to the problem. So there you have it, a quick overview of blood pressure and what you can do to keep it at healthy levels. Remember, high blood pressure can affect anyone regardless of age or lifestyle. But by following the tips above, you can lower your risk for hypertension and keep your heart and blood vessels strong and healthy for years to come. If you enjoyed this video, please leave us a like and share it with your friends and family. Thanks for watching. I'll see you next time.